Hey guys, Dr. Palubin here with Bona Vita Physical Therapy, and I'm here to talk to you about something that has recently been brought to my attention and asked by a friend of mine. Something that is called a plantar fibroma. They are nodules that are underneath your foot. They can be typically less than about an inch. I mean, more often than not, they're less than an inch, probably pea size. But they have a tendency to be very, very painful, especially if you are a runner and you spend a lot of time on your feet. I find that a lot of people that walk a lot, people on their feet constantly, nurses, healthcare professionals, obviously construction workers, people like that, are going to get these things, and not necessarily for any particular reason. They're still on the fence as to why they happen and why they're there. Oftentimes they think that it's trauma related, which would probably be the most logical reason. You have somehow or other indented the plantar fascia. It has created a small tear. The body goes in, tries to heal it with scar tissue, and the end result, you get a lump. The only real problem is if that lump becomes inflamed. Now, again, they don't know why these things happen. And the thing that I just suggested is a guess. They do find that they are typically more found in middle-aged men, and they don't know why, okay? So I know I've said that several times already, but they are kind of an anomaly, but they do show up. A lot of times, a physical therapist will find them because the patient will show up with plantar fasciitis that the doctor has diagnosed and confirmed, but then as we're working through the tissue, we find these little nodules that we then report back to the doctor, and then they confirm it through imaging or different types of testing, and it finds that, okay, you've got fibromas in there, go back to physical therapy and see if they can work them out. They really can be painful, guys. For a lot of people, they find that it's like walking on nails if they're super inflamed, or they end up feeling like they're standing on rocks with or without shoes on. Because basically, every time you put your heel down and your foot goes flat, your arch gets stretched. When your arch gets stretched, all that tension goes through the fibroma or the fasciitis, and you're gonna get pain. It's gonna hurt. So what they end up doing is sending people to therapy. First, they will usually try some type of topical anti-inflammatory cream, some type of steroid cream, see what they can do to reduce the inflammation and get rid of your pain. They also will look at giving you some type of arch support in order to help take the pressure off of it, reduce the inflammation. It has a tendency to really be helpful. Getting towards the more painful object or different treatments, they can do an injection of steroids into the fibroma itself. And then, of course, they send you to people like me. We get to massage out the plantar fascia, which through personal experience, it hurts a lot, but it does help. It loosens up that tissue. Sometimes it breaks up those little nodules and helps the tissue to stretch more normally. We also work through the calves, we work through a lot of the ankle muscles, really to loosen it all up, take off the tension. Once you take off the tension, pain is reduced. Now, it was also asked of me, does this require surgery? Sometimes the answer is yes, but everything I have done research on finds that surgery is an absolute last option. Basically, people don't always recover well from surgery through the plantar fascia, and the end result sometimes is you're left in more pain than what you start. And if you're on your feet a lot, or you're a runner, or something where the feet are used constantly, you can't have a lot of pain in your feet. So surgery is usually held as the last resort. Most people kind of acclimate to them and to the pain and the end result. They just kind of leave it alone, ignore it. They do their stint of therapy, they feel a little better, and they work around it. Now, there are no long-term studies at the moment as to whether or not these things get better with time or go away. They're on the fence, guys. This is something that is still being learned about and trying to be figured out. In the meantime, if you think you have plantar fasciitis, or if you think you have a plantar fibroma, then start with icing your feet. Maybe take a 2/3 filled water bottle, freeze it, roll your foot over it to try to alleviate the inflammation. definitely go see your doctor, guys. They can offer you some non-injectable type of pain relievers, not necessarily like narcotics or things like that, but type of anti-inflammatory creams, things like that. Go see a skilled physical therapist. We can loosen up the tissue. We can help with a lot of the pain issues. Yes, guys, it hurts while we're doing it. I cannot even remotely say that it doesn't hurt. It hurts, but it took something traumatic to get to this point. Sometimes it takes something a little traumatic to get rid of it. All the patients I've worked on with plantar fasciitis all say that they feel significantly better after just a couple treatments. It's worth a little bit of discomfort, guys, to feel better and get back to what you love doing. If you have questions, please reach out. Comments are below. My name is Dr. Palubin again with Bona Vita Physical Therapy. I work in Tampa. I can help you get rid of that pain. If you have questions, reach out. I'm sure I can answer them. But in the meantime, if you have foot pain, either see a licensed physical therapist for a short period of time, definitely go see your doctor, and we'll be back later with more information on other health issues or questions you may have.